Hello, my name is Ahmed Aziz and I'm an oculoplastic surgeon in London, and today we're going to describe the subtle yet significant differences between eyelid surgery or hooded eyelids and ptosis. Now, these two terms can sometimes be used interchangeably between people, yet they mean very different things, and the surgery or the surgical approach for these two conditions are also incredibly different. So hopefully after this video you'll be able to understand the differences and see if either or any are applicable to you. Though at a glance they may seem the same, they're both eyelid surgeries, but they are worlds apart, and it's crucial to know so you can find which path to choose. Ultimately, they represent different things, yet they can both look similar. So if you have excess upper eyelid skin, that can give you the appearance of a ptosis, even though you may not have a ptosis. And at the same time, you may have a ptosis, and if you were to correct that on its own, you may then mask that there is upper eyelid skin that's excess and that you may need blepharoplasty surgery for that as well. So what is the exact difference between both? So hooded eyelids or dermatochalasis is usually aesthetic. And you might notice an extra folding down of the upper eyelid skin, and this is usually a hereditary thing or something that happens to most of us as we age. Sometimes that excess skin can become so excessive that it goes over the eyelashes and it starts to block the vision. In most cases it tends to be caught a bit earlier, and you find that it's covering over and it's causing difficulty with makeup or with confidence and changes in appearance. So the result of this change, or the excess skin coming over, gives this droopy look. However, in most cases the vision is unaffected unless it's really severe and it starts to block your pupil. In that way you might be able to get surgery done for functional reasons and not for a cosmetic reason, if it's that severe for you. So why does this happen? It's a really important question, but also it's good to know that when it does happen, this isn't a medical condition. This isn't that there is a disease process going on. This is just normal. It's part of the aging process, and it tends to happen to most people as we age, and it's just part of life and how we live with it. Ptosis is slightly different to excess upper eyelid skin, and here the eyelid itself is drooping due to weakened muscles within the eyelid. So we know that there is a muscle called the levator muscle, and the levator muscle is within that eyelid, and sometimes if it comes away or it's not working too well, then you can have the eyelid not lifting as high as it should do. This isn't about excess skin here, it's about functionality, and it's about that the eyelid is not lifting due to the muscle work within it and not due to the skin. In severe cases of ptosis, vision can be blocked and can sometimes be blocked quite severely, and it's unlike the cosmetic approach with blepharoplasty where some of the skin is hanging over. Often with ptosis, if the ptosis is severe, if it's really blocking the vision, surgery is the go-to solution, and it's important to be assessed correctly just to make sure which ptosis surgery is best suited to you. If you're still unsure whether you have excess upper eyelid skin or you have ptosis, it's better to check with a specialist such as an oculoplastic surgeon to be sure of which one you have. That way they can then steer you in the right direction and tell you whether or not this is something that's cosmetic or if it's functional, and you may get an improvement in vision, but that all requires an assessment, usually in the clinic. At Eyes Defined, we are oculoplastic surgeons, and we're here and we offer specialist opinions in a honest and non-fussy way to try and assess whether or not this is a functional or a cosmetic issue, or whether or not you have any issue at all. So we're here to help you see clearly, and if you're interested, then you can please make contact.